Pregnancy should be a time of joy and not anxiety for the woman and her family. Do you want to learn more about pregnancy or have questions about fertility and reproductive health? Then join Dr. Linda Vanutu on Facebook and YouTube every Saturday at 4 p.m. on the online pregnancy school as she discusses pregnancy, delivery, and childcare with
everyone, welcome to today's program. It's a beautiful day out there and I hope you're enjoying it. Well, the last couple of weeks we have been talking about practices and beliefs in pregnancy, and we have already spoken about food taboos and some of the foods that pregnant women are advised not to eat. And just to remind us, one of the key ones is that they should not eat eggs, because if they eat the eggs, the children will become thieves, or that child will be bald because the egg doesn't have any hair on it. Another one is that they should not even eat fish, because the fish can affect them, and if this fish has teeth that are sharp, they will travel into the womb and cut the cord, and that will end that pregnancy. Well, maybe you have heard of some, maybe you know of reasons why people do that. Just share them with me. Put them in the comment section. And on Facebook, look for me, The Pregnancy School. My name is Dr. Linda Vanutu, and it is always a pleasure to come your way. We are doing these sessions because we want to help to reduce preventable maternal and newborn deaths. Every year around the world, thousands of women die. Millions of babies die from preventable causes. And the preventable causes mean that if they could do something and the health sector could also do something, these women and the babies would survive. So we are bringing these sessions to you so that we learn more about pregnancy and delivery and childcare. So we help ourselves and we help others. No woman should die whilst giving life. I'm sure you agree with me. Today, I'm going to continue with our session on beliefs and practices during pregnancy. And one of the things I want to start with is with alcohol intake. Some pregnant women, because of vomiting, because of the fact that they feel like vomiting, but not vomiting, and they also do not have appetite to eat at the beginning of pregnancy, they believe that if they take a little alcohol, it will help them. But dear viewers, when you take in the alcohol, it will travel to the baby. So though you are the one drinking the alcohol, the baby will also be drinking it. And we have had a session on alcohol use in pregnancy. Now, when this happens and the baby is born, this baby will suffer the effects of now not having the alcohol, a newborn baby, and other effects that this alcohol will have on this child. So please go ahead, look for that video and listen to it. And please, if you're a pregnant woman and you cannot eat, don't use the alcohol as an appetizer. Talk to the nurse, talk to the midwife, talk to the doctor, and let them help you. Even if you are close to a pharmacy, I believe you can go there and talk to the pharmacist. All of them will help you. We want to have babies that are normal and that are healthy. So please don't use alcohol as an appetizer. Another important thing that we want to talk about today is with weight gain, the weight that pregnant women gain during pregnancy. Now, some of them believe that when they put on a lot of weight, it means that they are carrying boys, the babies are boys, or that they are carrying twins. It could be that your baby is a boy or that you're even carrying twins. But please, when you go for the antenatal, they always check your weight because that is important. Because of the baby and the placenta and water and other things, you will definitely put on some weight. But the weight should be of a certain amount. And If you go and they check your weight, they will let you know whether the weight is okay or you are putting on too much weight. But you see, during the antenatal, which we have also spoken about, they don't just look at the weight, they look at other things, including laboratory tests. So when they do all that, they will put it together, because during pregnancy, some women develop what we call pregnancy-induced hypertension. They develop preeclampsia, which can go on to become eclampsia. We have spoken about this also in the past. So please look for that video and listen. It is one of the major causes of complications in pregnancy, as well as, unfortunately, death of the mother and the baby. So please, if you realize that you are putting on too much weight, your hand has become too heavy for you, your feet are swollen, your tummy is so big, don't just take it that you are carrying a boy or you are carrying twins. Go to the hospital. Let them check. If everything is okay, then that is fine. But if they find that your blood pressure is also going up and other things are happening, they will put all together and give you the treatment that you need. We want to help mothers and babies to survive. Another thing is that some people have headaches. They have dizziness. They don't see things the way they used to see them. Objects look blurred. That means that they are not very clear. And some of these are to do with the preeclampsia that we are talking about. So if you put all together and you go to the hospital, just let them be aware that I feel dizzy, or I don't see well, or I have headaches. Don't just take it that it's all because of the pregnancy or because of whatever. Please, when you go to the hospital, let them be aware of that, because we want to reduce maternal and newborn deaths. I hope you've got that. So remember, no alcohol for you as a pregnant woman, and also too much weight gain. If you have that and other things like headache and the rest, don't just attribute it to the pregnancy and stay at home. Unfortunately, some women have lost their lives. Some have lost their babies because they did not know that when you have these headaches or you have put on too much weight, it is because there is something wrong, but not just that you are carrying a boy or you are carrying twins. I hope that helps. Another thing I want to talk about is the antenatal medications or the drugs that we are given during the antenatal. Some people believe that when you are giving those tablets, hey, my sister, don't take them. Don't take them because the baby will be too big. And when you go to deliver, you cannot deliver by yourself. You have to go through a cesarean section. Wow. You see, every tablet that is given during the antenatal is important. It has a role to play in the life of the mother and the baby. If you have any challenge when you take them, just talk to the midwife, talk to the doctor. But don't stop it because you think the baby will be too big. No. Cesarean section is performed for a specific reason. And we have again spoken about cesarean section, where I took you to the theater to see how it is done. We need a doctor, we need a skilled person, we need an anesthetist, we need somebody, a lot of people to work together. So it is not so simple that they give you the antenatal. Otherwise, every pregnant woman will go through cesarean section, because every pregnant woman is given a tablet to take. 1, 2, based on what is wrong with you or what is not wrong with you. So please, if you are giving these antenatal tablets, just take them, because they will build you up as a mother. It will help you with your blood formation. It will help you with other things, and also protect this baby from some complications that can occur if these tablets are not given. But if you take them and you think that you are having challenges, don't stay at home. Just go to the hospital and let them check that for you. I hope you got that. So you see, there are so many things that we can do as pregnant women to help us. And if you have not yet subscribed, please go ahead, hit that subscribe button. On YouTube, it is Dr. Linda Vanutu. And then don't forget to hit the notification bell. And on Facebook, look for me, The Pregnancy School. And follow me, like the page, and share. Also, if you have comments and questions, just go ahead and put them in the comment section. Or on Facebook, I will answer them. And if we need to talk more, we'll find a way of talking more. We want to reduce as much as possible preventable maternal and newborn deaths. And I want you to join me on that journey. I hope you will. Even if you're a male, just share with your friends. Share with your male friends. Share with your female friends, sisters, colleagues at work, anywhere that you are. And for the churches, it's also very important because some of these things that we are talking about, you find that they may not hear it anywhere. And when they get married, they get confused because they hear all sorts of things. As I always say, the pregnant woman hears a lot of voices. Which one should she listen to? Listen to the health worker. That will help you. Ladies and gentlemen, another thing I want to talk about during the antenatal is the wearing of Brasia. Some people believe that if a pregnant woman wears Brasia, it will affect the milk that is produced. We will talk about breastfeeding somewhere along the line, and you will understand how breast milk is formed. But during the time that the woman is pregnant, the body prepares itself for breastfeeding. And it is not because you put on Brasia or you did not put on Brasia. It is because of the body responding to what it is about to do, that is getting a baby to feed. It is something that God has put there for us, thankfully. So if you are at home and you are comfortable not wearing the Brasia, that is fine. But if you are going to work, you are going to town, and you are afraid because when you wear the Brasia, your breast milk will not flow, I just want to suggest to you to find Brasia that is comfortable, that you feel comfortable in, and wear it, and that will not determine the milk that is coming. We will talk about breastfeeding, breast milk production, and you will understand it more. But please, just remember that the body prepares itself. So you find that when you are pregnant, your breast becomes a bit heavier than when you were not pregnant because it is preparing itself for breastfeeding. So that is another belief and practice that we have learned today. Now, another one which I would want to share with you is to do with pregnant women rubbing their tummies or scratching. Now, because the tummy is stretching with the pregnancy, as the pregnancy grows, and also because of other things that go on within the body, the hormones are there and the rest, she sometimes has this itchy skin and she wants to scratch. But some people believe that if she rubs her hand on her tummy, or even if she scratches the tummy, then what will happen is this baby will have stretch marks or scratches on the face, or the eye will be affected because she rubbed her tummy. Now, because of the itching, if you are itching as a pregnant woman, just find some Vaseline, or if you have shea butter, anything that you can find that will soothe it, and rub it on your belly. If this child's eye will be affected in any way, and it is something that this child will be born with, then it must be because of something that went wrong, or something that went into the mother that was sent to this baby. But please, if you are a pregnant woman and you feel like scratching your tummy, or it becomes so uncomfortable for you, the itching, then please put some shea butter on, or put something, maybe some pomade that you put on your skin. Just put it there and rub it. That's another one, right? If you know of some more, just go ahead and send them to me and I'll be very happy. It doesn't have to be one country. This is for different countries. Different countries have different beliefs, their food, taboos, and the rest. Some of them are similar. For example, the egg is all over. The fish, even some people believe that when a pregnant woman eats fish, it affects the quality of the breast milk. And then they even believe that if the pregnant woman eats a particular animal's meat, then the child will behave like that animal. So there are so many beliefs and practices out there, and it is good that we know them, and it is good that we share. Some practices are not difficult. I mean, they are not challenging for this woman. If you decide that a pregnant woman should be resting, that is good, but she should also be active a bit. And that brings me to the next one, which is to do with exercise. We have spoken about exercise in pregnancy. You see, we have done a lot for you to understand some of the things you can do in pregnancy. And some people believe that the pregnant woman should not exercise at all, but she cannot also sit at one place. So it is good that you do very simple, minimal, not strenuous exercises. And please, again, look for that video on the exercises in pregnancy. But one thing you can do is walking. Take a walk. Don't just sit at one place, because you have to be active. You have to be active. So don't sit at one place, please. Just take a walk around and everything will be fine. Again, if you have any challenge during your pregnancy, just go to the hospital. When you go for the antenatal, talk to the midwife about it. You can also send me a message and we'll be happy to answer you. I hope you have enjoyed today's session. We have looked at some practices and beliefs in pregnancy and the effects that these can have on the mother and on the baby. We want pregnant women to be healthy. We want their babies to be healthy. If you have any question, if you have any comment, please just go ahead and send them to me, and I will definitely respond to them. Share this with friends, share with family, share with married people, unmarried people, everybody, men and women alike. Share with everyone. And if you have not yet subscribed, just go ahead and hit that subscribe button and turn on the notification bell. And on Facebook, follow me on the Pregnancy School. Once again, my name is Dr. Linda Vanutu, and it is always a pleasure coming your way. I hope you have learned something new. We'll bring you some more of the beliefs and practices during pregnancy, delivery, and childcare. And I want to see you in my next video. Bye for now. Bye.